It's Sound Advice. Audiologist Doug Leonard from ASI, Audiological Services of Iowa, in the studio with us. Doug, we're going to bust out that old 80s phrase. Who are you going to call? Like Ghostbusters, that whole thing. When should they call a doctor for their hearing issues, and when do they need an audiologist? Let's break that down.
Yeah, that's a great question because I don't think people really understand that. This whole topic came up because I had somebody recently visit with me about a friend of theirs who had unilateral or hearing loss in one ear, and apparently for several years. And, I was getting this all secondhand, but, I just asked the question, have they seen an audiologist? Have they had a diagnostic evaluation? And apparently they hadn't yet. And, anybody that's experiencing hearing problems can come in and see an audiologist. Now, it does sometimes depend on insurance and, a person's insurance, whether they need a referral from their primary care doctor first. Number one, first and foremost, I'd say, John, if somebody has an acute hearing loss, so if they lose their hearing suddenly in one ear, that's a medical emergency. You should get into your primary care doctor and have that evaluated medically first. Hopefully, they'll then refer them back to us for a diagnostic evaluation. If folks have had long-term chronic hearing loss, they could certainly just call our office and schedule an appointment. It's usually something to do with, just the aging process. They call it presbycusis. It could be noise exposure, occupational hearing loss. It could be genetic. And the job of an audiologist is not to medically diagnose that. We aren't allowed to do that. That's something physicians can do. But we should be certainly giving proper referrals on if there's something that we see that's unusual. That person who had hearing loss in one ear, if they had called my office and set them an appointment and we found a big difference in their hearing, I would say you need to go see your primary care doctor or maybe even an ear, nose, and throat doctor and have that evaluated because unilateral hearing loss is unusual.
Does pain have anything to do with it?
Well, yeah, otalgia, pain in the ear, otalgia is what that's called. That's something that a patient should see their primary care doctor for. Likely that could be an earache. Oddly enough, sometimes it can actually be related to jaw issues. Again, their physician or an ear, nose, and throat doctor can help them figure that out.
Yeah, I'd say it's probably 50-50. Would you say you refer people back to doctors and doctors refer patients to you?
Yeah, we get primary care referrals all the time and then, of course, work with the local otolaryngologists, ear, nose, and throat doctors as well.
So there's lots of things that can happen. But again, audiologists are probably one of your best first calls, wouldn't you say?
Absolutely. If it's, again, a chronic hearing loss, something that didn't occur suddenly, we work in concert with their primary care doctors and always try to give good reports to the physicians. So if it is a medical issue, they can have that resolved through their doctor.
Yep. So who are you going to call? ASI. That's who. Audiological Services of Iowa. Doug, what's your number and how often are you here in Carroll?
Yeah, the office is open Monday through Thursday. I see patients on Monday and Wednesdays, and the number is 792-5933.
Give them a call. If you're having issues with your hearing, again, if it's something you've been dealing with for a while, start right there with ASI, Audiological Services of Iowa.